Hello, Dr. Mike Matthews, physical therapist here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, and Instagram so you can be notified when I come out with new content. Today, we're going to be talking about upper back pain. Well, rib pains for that matter too. Pains that are related to our thoracic spine and our rib cage, our thoracic cage here. But the big thing is, when we're having pains in these areas, we have to make sure we know exactly where they are coming from, because there's lots of referral patterns that come off the spine, lots of radiating and radicular pains that can come from other parts of the spine that can radiate to there, primarily the neck. So we got to make sure that we roll the neck out first, and if we can't, we've got to at minimum treat the neck, if not the neck and the upper back, when we're having pains to these areas. One of the biggest diagnostic mistakes I see is when people are having pain just in this scapular region, just in the shoulder blade area between my hands right here. They automatically think it's coming from the thoracic spine, it's coming from that upper back, when 99% of the time that pain is actually coming from the neck. So we got to take a look at that neck as well and make sure that we're rolling that out when we're looking at our upper back pains. And when we're talking about upper back pains that are more between the shoulder blades here, between my fingers here off the top and the bottom, now it gets a little bit more murky. The water's not as clear. That could be coming 50-50, either from the neck or from the back, or a combination of both. So we need to try to figure that out as well. But when the pain is happening a little bit lower in that upper back and down, especially when it starts to wrap around our rib cage here, or even going down further and wrapping around down into our stomach area, that's the telltale sign that it's coming from our thoracic spine. Those are the common areas that we will feel it there. So let's go ahead and self-assess. We'll take a look at the neck first. We got to check out mobility. We need to see if we're reproducing our pains by moving that neck around. We have to check our side bending. And when we're checking each direction, make sure we're going as far as we can. We're not just going a little bit and then stopping. Take it as far as you can into one direction, as far as you can in the other direction. We're seeing if any of this is reproducing our pains, or if we're feeling tight or stiff or stuck. Next, we're going to take a look at rotation. We're going to twist our neck to one side as far as we can, off to the other side as far as we can. Again, looking for restrictions, limitations in motion, if it's reproducing our pains or not. Now we got to look in this sagittal plane here. Got to look at protruding forward. We have to look at flexion, retracting back. We're going to take a look at extending up. And we also have to take a look at retracting, working in to extension there. Again, seeing if it's reproducing any of our symptoms and seeing if we have any restrictions or tightness as well. And if we do, we've got to treat the neck first. Even if the upper few segments of that upper back, right below that neck, are the ones that are getting affected, a lot of times just treating the neck will fix our problems without even having to touch the thoracic spine. So we definitely want to look at the neck first, treat that if we're seeing anything there, to see if it helps out with our symptoms or not. So let's assess our upper back now. We need to make sure that we're sitting with these ones. We want to keep our hips nice and stuck in one spot up against the chair there, but we need to be forward in the chair a little bit so the back of the chair is not limiting our mobility here. So first thing we're going to do here is supporting our head. We have to make sure that our elbows are coming forward. If our elbows are back, our shoulder blades are going to get in the way of our movement. We have to make sure that our arms, our upper extremities stay forward here, and we're going to try to arch that upper back as much as we can. Again, looking for our symptoms, feeling if something is tight or stuck. We're going to do the same thing, coming forward here, rounding up that upper back as much as we can. So we'll take a look at these two from the side. Here's our extension coming back this way, and then flexing, coming down forward, right in there, really rounding out the upper back on the second one. Really extend and try to arch on that first one. We have to take a look at rotation as well. So we can put our hands in front of us here. We are turning our neck and our upper back all at the same time to make sure we're getting rotation at every single segment in that upper back there. So rotate the head and that upper back here, rotating off to one side, and we're going to go the other way. Again, looking if we can reproduce our symptoms, if it makes it worse, if we're getting restricted, especially with this one, we have something to compare to see if one side isn't going as far as the other side there. So let's say we're having pain in our upper back that's wrapping around. We take a look at the neck and we have some positive signs. Take a look at the neck first. We'll clear that. We'll treat that. I have a video on that, so make sure you head over to YouTube or Facebook so you can check out that video before we move on here. We're still having some pain in that thoracic spine, or we even looked at the neck, there was nothing happening there, and we saw some positive signs with that thoracic spine. Time to treat it. The number one thing, the first thing that we're going to look at is extensions. We're always stuck forward when we're sitting at work, sitting at home, at the dinner table, in front of our computers, on the couch. We're always slumped forward. If this is the position that is causing our problems, stretching further and further into it will not help. You'll see a lot of people try to do some form of stretching out this way because you actually feel the muscles in the area that's hurting. You feel those stretch out, and a lot of people think I'm feeling a stretch in the area that's hurting, it's got to be good. But if we're just going further and further into the offending position, it's going to make things worse overall. We actually have to go in the opposite direction. We have to reverse that. So I'm sitting in a chair right here, and I'll actually make it sideways so you can see my seat back. Starting off not too aggressive, we're supporting our head again. Elbows stay forward, and we're arching that back as much as we can, and then just coming off of it. We're not holding more than a second. We're repeating that movement 10 to 15 times, and we're seeing if this starts to relieve our pains or not. But we're not only looking to see if it relieves those pains, we're seeing how the pain behaves. If it starts to change locations, it gets more or less intense. If we start to feel that our pains are getting more localized right in the center on the spine, that even if the pain is getting more intense, even if it's getting worse, if we can get that pain, that wrapped around pain, or that pain that's more across the entirety of the upper back, if we can get it localized on the spine, that is always a good sign. If we can centralize that pain, that is always a good sign. We keep going with it because we are definitely going in the right direction here. So let's say we're working on this, we need a little extra, it's giving us some relief but not a lot. That's when we need to start using the back of the chair here. We want something that's at about shoulder blade height. Arms up again. We're going to use that as a pivot point to get more of a stretch there. Again, we're doing 10 to 15 times. We're working on this several times a day if it shows that it's helping. Now there's a couple strategies that we can use to stretch this out differently. This isn't going to work with everybody. Sometimes we've got to get that back unweighted, sitting up nice and tall. Gravity is going to push straight down axially on our spine. It's going to compress our spine a little bit. So if we can lay down, that'll give us a little bit more space since gravity will not be compressing those discs together. And also when we're laying down, sometimes we can do more of a sustained hold, holding it into one spot. The difference with that thoracic spine and then the neck and the lower back is there's so much more involved there. You have all of your ribs articulating with each of those 12 thoracic vertebrae. There's more ligaments, there's more joints, there's quite a bit more happening, and sometimes you need that nice low level stretch to get things going. So let's go over those now. So we're gonna get this chair out of the way, and we're gonna lay on the ground. We're gonna prop up onto our elbows here. Sometimes this might be a little too much starting off with, so we might have to lay a little lower or even all the way flat. We want to progress this nice and slow, so we start off at a comfortable level. After a few minutes, we want to try to prop up a little bit more. We can also move the placement of our elbows more forward or more back. The more forward our elbows are, the higher the segment will hit. The more back they are, the lower the segment that will hit. We'll stay here 3 to 5 minutes at a time to add to that extension. We can put our fingers underneath our chin here and relax into that position right there. If we're looking for more of a repeated movement here, we can do our press ups, but instead of pressing up with our hands underneath our shoulders here, we put our hands up higher, works these upper segments in that thoracic spine. So you're pressing up here, and back down. To increase the stretch there, we come up, we lock our elbows out, take a deep breath in. As we breathe out, you let everything relax and everything sags down. You work on that one as that repeated movement. After everything's relaxed, you lower yourself back down just to come right back up. Breathe in and out. Same thing, working 10 to 15 times. I know laying down, it's not as common, it's not as easy to find a place to do this all throughout the day. So when you're at home, you have a place to do these, do them then, and then throughout the day at work, we'll do our seated exercises. So if we're having these thoracic pains and we're working through this extension and nothing is getting better, or if things are getting worse, we need to go back to the drawing table. We need to look at our rotation a little bit more. So we're gonna get our chair back over here. I'm gonna sit down so that we're locking out those hips, sitting here. And if we looked at that rotation going to one direction and it was limited and it wasn't limited going in the other direction, we're gonna start by working into that restricted area. We're gonna start off nice and slow, repeated movements here. We're gonna do a set, maybe 2 or 3 of 10, 15 reps. And we're gonna check and see if it's getting any better or not. If we feel like the pain is getting better, it's loosening up, or the pain is starting to centralize closer to that spine, we gotta keep working into that direction, going a little bit more and more. And over time, we have to get more aggressive with this. The reason being, we have so much in that spine, so much in that thoracic spine between our ribs, the joints between the ribs and those thoracic vertebrae, extra ligaments. There is a lot more in there that can limit, that can be restricted, and our muscles will only go through so much mobility when we're going slow and controlled. To kind of illustrate that right here, right now my spine is nice and healthy, no pain, no problems. If I work into this slowly, you can see how far I go, but if I go ballistic, if I go aggressive with it, I can go quite a bit further there. So we definitely got to start getting more aggressive with this if this is helping. So over time, we're going a little bit more. We're not going from 0 to 100 in no time flat. We're just starting to slowly add a little bit more force behind it. Over time, as it loosens up, we get more aggressive with it. If we've been working this rotation and it's feeling good, we feel like we've addressed the problem, we have to go back through our extension protocol here. If at any point in time our extension protocol, that progression starts hurting us again, we've got to stop. It's letting us know we haven't fully addressed this rotational component, so we got to go back to there and work on that a little bit longer. The same thing as this with the extensions. We have to work on this all throughout the day. Every 2 to 3 hours, we want to do a set of 10 to 15, maybe a couple of sets at a time. But let's say we're working to the restricted, to the painful side, and it's actually making things worse. Well, now we're actually going to go towards the non-painful, or the less painful and restricted side. So we're going to start off nice and slow. After we do a couple of sets here, we're going to retest the more painful side to see if it's getting better. If it is, start working through that progression over time. Over the course of the day, or over the course of a few days, we start getting a little bit more and more aggressive with it. The big thing is, if we're going to the side opposite of the restricted side, we have to check out that other side, the painful side, every once in a while, and then resume coming back this way. Same thing, once we feel like we've fully addressed this rotational component, the pain is under control, the pain is gone, and we're not feeling like we're getting any more benefit out of it, we got to go back to that extension there. If the pain starts coming back, it starts getting worse again, we've got to go back to that rotation because we haven't fully addressed that component yet. But the main thing is to bring it all home. Once we get this addressed here, or we start to get this addressed here, we've got to maintain a healthy spine. Or even if we've never had problems there, we still want to make sure it's nice and healthy so we can avoid these problems in the first place. So especially if you have a job where you're doing a lot of bending, a lot of squatting, you're sitting at a desk for long periods of time, anything that's putting you in a compromised position, we have to reverse that all throughout the day. That's when we're coming in, we're doing our exercise here, or even if we're always twisting towards one side. We're on a factory line, we're at a warehouse, anything like that, we're always rotating towards one side but not the other. We've got to make sure that we're fully addressing that rotational component in that thoracic spine as well. So if all throughout the day we can identify certain positions or postures that we're always getting into, it's a good idea, it's a good practice every once in a while to stop and not stretch out further into that direction, but actually work into that opposite direction or those opposite directions. And that's what I really want to be the number one takeaway with this right here, is we always have to maintain good mobility, good positioning throughout the body, not even just that thoracic spine, but throughout that body. We always have to make sure we're mobilizing things, we're stretching things in the opposite direction of the directions that we're always working in, those stresses that we're always putting our body repeatedly through or throughout those postures. We want to turn this into a common practice of our daily routine so we can invest in the future of our health now. Again, I'm Dr. Mike Matthews with the Physical Therapy 411. Make sure you follow, like, subscribe, Facebook, YouTube, and Instagram. I'm going to be going over thoracic spine and ribs over the next couple of videos, so make sure you tune in so you can be notified when I come out with that content. Thanks for joining me.